All right, good afternoon. So we shall be starting now um, on Tuesday. And the most important thing for today, of course, is, well, your upcoming lecture exam tomorrow. Something to keep in mind. I did share the study guide for that one earlier as well. And then on Thursday, of course, we have our lab practical number 3. And the study guide was sent out for that one too. Those are the two things coming up as of now. Of course, your Connect quizzes, that's an ongoing reminder to make sure that you are able to keep up with those and the case studies that need to be sent in before the deadline. All right, so with those reminders and hoping everyone is having a fantastic day, let's go ahead and uh, go by the schedule, which means we are going to go over chapters 11, part 1 and part 2, hopefully today, okay? And this has to do with muscles, okay? And yesterday we talked about our introduction to that body system, the muscular system. We talked about how they are contractile, right? That is that one outstanding feature that applies to muscles. They come in 3 different varieties: the skeletal muscle, smooth muscle, and then cardiac muscle as well. They also are excitable, all right? So they need electrical impulses and calcium ions and neurotransmitters like acetylcholine to stimulate them. And then we talked about some of the pathologies and disease conditions that can apply to muscles like myasthenia gravis, like botulinum toxin, botulism, as it is called, or tetanus, right? We talked about all of those conditions. All right, so today we shall go ahead and take a look at uh, those specific muscles that constitute the human body, and there's about 650 of them, roughly, okay? Uh, Compare that to only 206 bones in the skeletal system. So by far, we have more muscles than there are bones. And it makes sense because bones are just the attachment points. The muscles are actually what cause those movements. So here we're looking at axial muscles versus appendicular muscles. And again, the term comes from axis, which means the axis, the center, the midline, the midpoint of the human body. So the muscles of the neck and face and head, uh, also the thoracic and the abdominal region, they all constitute axial muscles, okay? And they are involved with things like facial expressions, of course, chewing, swallowing, um, and also maintaining our uh, upright posture. Okay, appendicular muscles. The term itself derives from appendages, which are attachments to the midline, and that includes the muscles of your upper limbs and your lower limbs, as well as the pectoral and the pelvic girdles that support the upper and the lower limbs. So we shall go ahead and take a look at those muscles. So here they are uh, with many different names. Now, the good thing about, well, there's a good thing and there's not such a good thing about them. So the fact that there are 650 muscles in all, well, it could be quite daunting to think of. Fortunately, you will not have to memorize the actions, the origin, the insertions, and the pathologies that apply to all of those muscles. But you should have some basic idea. So as I was saying, the good news is about most of those muscles, their names actually derive from uh, where they are located at, where they're attached, and how do they function, okay? So for example, if I choose this muscle here, it says sternocleidomastoid, all right? So 3 different terms. Sterno tells you it's attached to the sternum, your breastbone, cleido from clavicle, and mastoid, which is the mastoid process right behind your ear over here, right? So this muscle has 3 different attachments: sternum, clavicle, and the mastoid process, therefore the term sternocleidomastoid. Now, at the same time, you have to also know that which point is more movable, which attachment point is more movable as compared to the other ones. So obviously in this case, in the case of the sternocleidomastoid muscle, the uh, attachment over here behind your ear, the mastoid, is more movable. It allows you to move your head side to side or up and down, right? As compared to the attachments to the sternum and the clavicle, they are fixed. So the fixed points of the muscles are called the origin. So the origin for sternocleidomastoid would be the sternum and the clavicle. The more movable attachment, that is called the insertion. So the insertion here is the mastoid process behind the ear. So that applies to the sternocleidomastoid muscle, okay? So brachialis, another muscle, and the name tells you from the brachial region, which is your upper arm. So that's exactly where brachialis is found. Biceps brachii, right? So bi means two, seps, head. So two-headed muscle, brachii of the upper arm region. And as we shall see, the biceps muscle literally has like two um, origin, like two tendons, a bicipital tendon, that's what it's called, two edges to it, and therefore the name biceps brachii. So here you're looking at those muscles in a posterior view from the back, okay? And again, let's just pick this one out randomly. Extensor digitorum, digitorum from the digits, fingers, extensor, it extends the fingers. This is extension. Again, remember, extension means that the angle between two body surfaces is increasing here. If the angle is decreasing like this is flexion, flexion of the digits. This is extension and this is flexion. So extensor digitorum allows you to do this. All right. So again, names are making sense here. Gluteus maximus, I talked about that muscle quite at length yesterday. Okay. And so glutes is it has to do with the region, right? The buttock region here. Maximus means it's a large muscle. It's the most powerful stabilizer of humans because again, we are upright walkers, right? But that also tells you that there, if you have gluteus maximus, then you would likely also have gluteus minimus, right? Or gluteus medius for that matter, the middle and the smaller inner muscle. And that indeed is the case here as well. So the names basically refer to their location, as I mentioned, and their actions like flexion, extension, their shapes sometimes, like trapezius. Here's the trapezius muscle. Why? Because it's shaped like a trapezium or a trapezoid, like a kite-shaped muscle here, or a diamond shape there. You see, it's kind of like a diamond-shaped muscle in the back. It allows you to hyperextend your neck, to shrug your shoulders, to raise your arms. All of those actions are made possible by means of the trapezius muscle, right? This diamond-shaped muscle that you see here. So again, the names themselves are telling a lot about what those muscles are, where they're located, what they do, and those kinds of things. All right. So tendon, we talked about that before. Tendon is a connective tissue which attaches a muscle to a bone, a skeletal muscle to a bone. All right. So again, they have superior attachments and inferior attachments. So, and we're talking about the axial muscles, muscles in the midline of the human body, right? And so usually the superior attachments are more movable as compared to the inferior attachments. And that makes sense. If you, again, sternocleidomastoid, so the mastoid process is superior, more movable. The sternum and the clavicle are inferior, so those are not that movable. So in other words, in our old terminology, this would be called the insertion, the more movable part, and the part which is less movable would be called the origin, okay? And so, but if you look at the appendicular muscles, muscles of your upper and lower limbs, arms and legs, right? Then what did yeah, so the here usually the upper attachment is less movable, or that is the origin, but the lower or the distal attachments are more movable. So for example, for the biceps brachii muscle, right, this is the origin on the scapula, so that doesn't move. But what the biceps muscle does move is your radius, which is your forearm, right? So this is the distal attachment, also called the insertion, which is more movable. So a general scheme to remember here. There you go. Now you can see why it's called biceps brachii. Look at that. You see the two kind of heads there, proximal attachment to the scapula, the origin, there's two of them. So called the bicipital tendon, right? And then here's the bulk or the belly of the biceps brachii muscle. And here's the insertion on the radius, which pulls it's basically the radius that moves. The other proximal attachment is mainly for anchoring the muscle there, all right? So that is the difference between origin and insertion. And perfect example here. Okay, so in this picture, you can look at different types of muscles and what they do. Again, they could be circular, parallel, convergent. So let's start with the first one. One example would be this, orbicularis oris. Again, look at the name, orbicularis. It's an orbit-shaped muscle, and oris from oral, around the mouth. There you go. Circular muscle. What it allows you to do is to like whistle, all right, or purse your lips or blow a kiss or whatever. Those are all um, functions of the orbicularis oris muscle, as you can see here. This is an example of parallel muscle, like rectus abdominis. Again, if you look at the name, rectus means like straight. It's going straight down. If you look at the fibers, and abdominis, of course, it's from the abdominal region. So therefore, the name, the rectus abdominis muscle, right? And as you can see, this is one of your six-pack muscles, right? So there's actually three different groups that form the so-called six-pack. We'll talk about them as well. This is just one. You also have transversus abdominis, in which the fibers, instead of running straight down, like in rectus, they run like this, sideways. So they're therefore transverse. So therefore the name transversus abdominis, okay? All right, then you have convergent, like your pectoralis major muscle, their pectoral, your chest region, major, big muscle. It's convergent because look at the fibers, they're all converging here into the tendon. So it's like all converging, therefore the term that you see here, right? Okay, and then you have a unipennate muscle. And unipennate means it has a single leaf, uni and pennate, like a leaf shaped structure, right? So a single leaf muscle basically is what it stands for. And the reason why it's called that is if you compare that with the bipennate muscle, which is right next to it, you see how it has uh, kind of like two leaves, right? You have the muscle fibers running here in these two directions versus the unipennate muscle where all the muscle fibers are running in the same direction. Also, if you look at the names, extensor digitorum, this one we discussed earlier, and that basically tells you pretty much what it does. It extends the fingers, right? Extensor digitorum. And here is the extension of the fingers that the muscle accomplishes, rectus femoris. So again, rectus means straight fibers, as you can see here. Femoris from the femoral region, which is your thigh, right? So this is a thigh muscle that you're looking at. And then you also have a multipennate, which means multiple leaves running in these different directions, right? And example is deltoid. Doesn't tell you much about the location, but it does tell you about the shape. It's the shaped like the Greek letter delta. All right, and so this is the muscle here, like a delta, Greek letter, delta shaped muscle of the shoulder, and that helps you abduct the shoulder, rotate it laterally and medially. All right, those are all the actions that this multipennate, many different leaves, multipennate muscle performs. So here are different actions of different types of muscles. For example, the first one is called an agonist. So agonists are those muscles that perform a certain motion. For example, as it says here, when you're extending your arm, here's your forearm extension. The agonist, the primary muscle that does that is your triceps brachia. And look at the name again, triceps. Tri means three, ceps for head again. So triceps means a three-headed muscle. As we shall see, it literally has three different points of attachment, right? And so that is the prime mover or the agonist for forearm extension. Antagonist is the exact opposite. Antagonist is a muscle that, first of all, remember that skeletal muscles work in pairs. They work in pairs to make a body part move. And when one part of the muscle contracts, the other one extends or relaxes, okay? And when then that one flexes or contracts, the other member of the pair has to relax or extend, okay? Because if you're flexing both muscles at the same time, there will be no movement possible. So antagonist is the opposite muscle. For example, when you make a muscle, like when you flex your forearm, the biceps brachii is contracted, but the triceps brachii is relaxed, as you can see, right? And that allows you to flex your forearm. When you extend your forearm, the exact opposite happens. The triceps brachii is contracted here, and the biceps brachii is relaxed. So that's what antagonists do. They work in pairs. Synergist is a smaller muscle usually that helps the agonist do its job. For example, when you flex your forearm again, the prime mover here is basically your biceps brachii, right? But the brachialis muscle also works along with the biceps to help you accomplish this forearm flexion. So therefore, they act synergistically. Okay. So what is the difference between the proximal and distal attachment of a skeletal muscle? The proximal refers to something that is closer to the attachment, right? And in terms of muscles, uh, the proximal attachment of the muscle, if you're talking about the axial muscles, the proximal muscle is usually more movable. So that would be considered the insertion. In appendicular muscles, which apply to arms and legs, the proximal attachment is usually the origin. So that doesn't move as much. All right. So that's the difference between proximal and distal attachments of a skeletal muscle. Which muscle is stronger, a pennate muscle or a parallel muscle? A pennate muscle, okay, because it's like broken down into these leaves, and that gives extra strength or extra power to the muscles. What is the difference between an agonist and a synergist? An agonist is the primary mover, such as the biceps brachia is the primary mover of the arm, forearm flexion. And a synergist is a smaller muscle that helps the agonist do its job. Okay. So here, this is how we name muscles, and we talked about this earlier as well. Muscles are named according to their actions, what they basically help you accomplish. They also sometimes denote specific body regions where they're coming from. They can also refer to their origin and insertion, their attachments. They can also refer to the orientation of muscle fibers. For example, when you talk about the rectus abdominis muscle, rectus means straight down like a sheet, right? Versus transversus abdominis, which means transverse, laterally running fibers. So all of those uh, could apply here. Muscle shape, like the deltoid, all right? So it's like the Greek letter delta, again, or trapezius in the back. So diamond-shaped, trapezoid or trapezium-shaped muscle. Okay, and muscle size, like gluteus maximus. Maximus, it's a large muscle, largest of the buttock muscles, as you can see here. A number of muscle heads at an attachment site. Again, biceps two-headed, triceps brachia is a three-headed muscle. So intramuscular injections, right? Muscles are quite often used for administering injections. And what types of injections come to mind? Those that require sustained delivery over 12 to 48 hours, not all at once, because if you want immediate, instant action, you want to give it IV, intravenously, right? Um, Not so with intramuscular injections. So there are many examples of what types of drugs need sustained relief. For example, hormones, right? So hormone replacement therapy, you can get injections for testosterone or for birth control, estrogen, progesterone combinations. They are intramuscular, right? Sustained pain relief. For example, one of the most commonly used, uh, something that I personally used a lot for pain control in patients is a drug marketed under the brand name Maxit, and it's basically something called diclofenac sodium. Okay, and so this is a long-term sustained release painkiller. All right, it's quite effective. So some of these types of injections also could be administered there, right? What else? Your DTP injections, right, for vaccinations, they're often given in your muscles, again, because for sustained release of that medication. All right, so that's what we are looking at here. Some common sites where you give them, deltoid region. These are large muscles which are easily accessible, so therefore easy to get to, and then they are large enough to hold on to that drug for longer periods of time. In the thighs, the quadriceps region, the gluteal region. So what are some words used in muscles names that refer to muscle shape? Deltoid, trapezius, right? Um, the gluteus maximus muscle gets its name from which categories for naming muscles? The size. Maximus means large. All right, so let's take a look at the muscles of the face. All right, so and again, in humans, these are quite important because as humans, we are primed to read each other's facial expressions. No other animal reads facial expressions to the extent that humans do. For us, it could be a matter of life and death, and all kinds of decisions based on the person's facial expressions. So, what are some of those muscles? Again, I like to call them uniquely human muscles because, as I mentioned, only humans have this high capacity for reading the facial expressions and making connections with what types of underlying emotions are likely going on, right? If it's an angry face or a happy face or sad face or worried or concerned or whatever the case is, right? Um, and so they did this interesting study, and they found out that people who scored quite high on the psychopathic scale, right, um, uh, basically were not able to pick up these expressions, facial expressions that normal people, non-psychopathic people are able to, right? Scale and facial expressions. So when they were shown, and these were people who were like incarcerated, they were in jail and prisons, and they had many psychological and psychiatric tests done on them, and they had been classified as kind of certified psychopaths. And so they were shown all these different pictures of people in pain, people enjoying pleasure, or people who were worried or nervous or laughing. And so they were unable to tell exactly what the person is feeling based on the facial expressions, which was not the case with uh, the other people in the control group. Okay. And so what the conclusion that they reached was, well, that seems to suggest that psychopaths basically are pretty good at mimicking other people's emotions. So they're able to pick up and they know how to respond appropriately to different uh, cues, facial cues, even though they don't feel it. They just are wonderful mimics. They learn how to do that. All right, interesting. Okay, now let's take a look at some of these muscles. So let's start. Sternocleidomastoid, we talked about that one before. The largest, one of the largest muscles in the head, neck, facial region. So sternocleidomastoid. These terms refer to the what? To the attachments, the origin and the insertion. Mentalis, mental region, which is your chin. Again, orbicularis oris. We talked about that one too. Orb-shaped muscle of the face, right? Buccinator. Now this is a large muscle which allows you to like kind of puff your cheeks out, like when you're blowing a bubble or something, right? Or exhaling air. Buccinator. Masseter is a powerful large muscle of mastication, which means chewing, right? So masseter right here is a major muscle of, of mastication. So here you're looking at what is called levator anguli oris. Now look at the name. Levator, from elevation. It elevates or lifts the angles, anguli oris, of your mouth. So this muscle elevates the angles of the mouth, such as when you kind of smile, right? Nasalis, it allows you to flare your nostrils, nasal muscle, right? Levator palpebrae superioris, again, look at the name. It elevates, levator, the palpebra, the palpebra are your eyelids, superioris. So it helps you open your lids upward, superioris, right? Corrugator supercilia, it um, causes you to like form a frown, you know, the number 11 that you get there on your forehead because of frowning. So it's this muscle, the corrugator supercilia, which basically allows you to frown. Okay, and so if you're going for Botox injections, those are precisely the kind of muscles that you're trying to paralyze. So all of these like creases on the skin do not form. All right, epicranial aponeurosis. We talked about this one yesterday, right? So this is your occipitofrontalis muscle. This is the frontal part, the frontalis, and the back is the occipital part, occipitalis, right? And the two are joined by means of this flat tendon called the epicranial aponeurosis. All right, what else? Orbicularis oculi. Now there again, it's rounded, orbit shaped, oculi, ocular, eyes. So this is the round shaped muscle which goes around the eyes and allows you to what? Again, open your eyes, okay? And widen them, widening of the eyes. Levator labii superioris. You can tell me what that means. Labium is for lips. Levator for elevation. It lifts your lips upwards, such as when you expose your teeth, right? You kind of fold back your lips to expose your teeth. Zygomaticus major, zygomaticus minor. Zygomatic arch is your cheekbones. So again, it's one of the smiling muscles too, gives you a smiley face. Risorius, same. Depressor anguli oris, it's a depressed muscle. And so the name is quite appropriate for the action that it performs. It depresses or pulls down the angles of your mouth, right? Like a sad face. Depressor labia inferioris, same thing. It pulls your lips downwards, inferioris, right? Platysma is a sheet-like muscle. That's exactly what the name itself means here. All right, so in a lateral view, you see it's many of the same muscles that we have just discussed, right? So it's wonderful. The names pretty much tell you about the location, the actions, uh, the orientation of the fibers, the size of the muscles, so much important information embedded in those weird tongue twisting Latin slash Greek names. All right, so we are not complaining there, hopefully. Temporalis, temporal muscle from the temples. And this is also a muscle of mastication, chewing. It allows you to chew, okay? Temporalis muscle here. Okay, what else? We talked about all these. So here's our guy, right? And hopefully, I'm hoping well, I don't know if it's, so I'll just try to stay neutral. So uh, all the psychopaths amongst you notwithstanding, I don't know how many of you are on the psychopathic scale, but you're able to recognize these emotions, right? Uh, and who knows, I can tell you this because I've seen at this slide 1,000 times before, if not more. So maybe I'm mimicking, who knows. But you can see here the sad face, right? And the muscles that we talked about, depressor, anguli, oris, orbicularis, oculi. So the eyes tightly shut. These are the smiley faces, right? Zygomaticus major, orbicularis oris for like puckering of your lips, the frontal belly of your occipitofrontalis muscle for forming these creases, lines on your forehead, platysma, the muscle of the neck, okay? So Bell's palsy, it is a condition where you might suffer from a unilateral, one-sided paralysis of the face, okay? And it could be due to sudden exposure to cold temperatures, due to stress, sometimes like viral infections, viral colds, those kinds of things can bring this on as well. Usually, this is self-limiting. So even if you do nothing, after a few days to sometimes even hours, uh, your muscles regain their function, okay? So there's idiopathic, that term means there is no known cause for sure, okay? There's a number of factors that can contribute. You can use steroids like prednisone to reduce swelling and to hasten the recovery time here. Okay, so next up, we are looking at the eye muscles. So look at the eye here in a lateral view, as you can see, right? So, and again, the names pretty much go with the location. So what do we have here? Lateral rectus on the side of the eyeball, laterally. Inferior rectus, inferior, down, right? Superior rectus on the top, as you can see. And you also have one called the superior oblique muscle, which kind of goes through it's kind of like the pulley, like a pulley if you're weightlift and stuff, right? Called the trochlea, this little bony projection here. It goes through there to hold on to the upper part of your eyeball. And then of course the inferior oblique here kind of goes transverse like this, okay? So let's talk about the actions. What do they do? Exactly what the name suggests. Lateral rectus will allow you to move your eye laterally. So my right lateral rectus, I can move my eye laterally. Medial rectus, for my right eye, I'm moving medially, right? So, but when I'm using medial rectus to look this way, here, I'm using my lateral rectus on the other side. So medial rectus, medial rectus, lateral rectus, right? So those. Superior rectus, moving, looking upwards. Inferior rectus, down, looking down. Simple enough, right? Okay, superior oblique, interestingly, even though it is a superior muscle, but it causes your eyeball to move downwards and medially, right? And inferior oblique, even though it's inferior, lower, it allows your eyeball to move upwards, superiorly and laterally, okay? So those are the actions. Now, their nerve supply. So here you can look at those muscles one more time, right? And one thing to see is all of these muscles, the rectuses, superior, inferior, medial, lateral, they come together in a common tendinous ring, a common tendon, which is attached to the bone at the back of your orbit or the eyeball, okay? There you go. Now you see, they almost look like the petals of a flower, right? The superior rectus, inferior rectus, lateral rectus, and the medial rectus. You can see the superior oblique and then the inferior oblique here as well. So the same muscles from a superior view, as you can see, okay? All right, so one thing that I would like to go back and mention here is, look at that. Um, All of your rectus muscles are supplied by the same nerve, which is your oculomotor nerve, cranial nerve number 3, except for your lateral rectus. The lateral rectus is supplied by your um, nerve number 6, cranial nerve number 6, called the abducens nerve, as you can see here. So remember, the lateral rectus is different in terms of nerve supply. It is supplied by your cranial nerve number 6, called the abducens. The other ones all have the same nerve supply: oculomotor nerve, cranial nerve number 3. As for the oblique muscles, the inferior oblique again is the same, cranial nerve number 3, the oculomotor nerve. But if you look at the superior oblique, the one at the top, it's supplied by cranial nerve number 4, called the trochlear nerve. Okay, so that one is different again, as you see. Okay, so here you're looking at your muscles of mastication or chewing. As you can see, the most powerful one there uh, is the masseter muscle here. Here you see masseter. And masseter allows you to elevate your jaw, to shut it. Like when you chew, the mandible moves up and down. The masseter does it. Temporalis, again, very powerful chewing muscle attached to the temples. And so this would be the origin, right? This would be the origin, because this does not really move that much, but the attachment on the jaw or the mandible would be the insertion, because that is the part, the lower part, that actually, the jaw, that actually moves. So that's what you're looking at here. You also have these two, the pterygoids, the lateral pterygoid and the medial pterygoid muscle. All right, and the pterygoids, medial and lateral, as you would have guessed, they allow you to move your lower jaw side to side. Right? So, for example, if you're a ruminant, right, like cows and cattle, they often regurgitate their food. They chew on the cud, right? So they move their lower jaw side to side. So they have really well developed uh, lateral and medial pterygoid muscles. So ruminants and pterygoids. All right. So, okay. Here we are looking at the muscles of the tongue, muscles that move the tongue. Okay. The good news, all of them have the suffix glossus. Gloss is for your tongue. Glossitis is an inflammation of the tongue, right, which can be caused by fungal infections, different kinds of chemical irritation, whatever. So glossus, if you see that suffix, you know you're referring to the tongue. Okay. And there's even better news, palatoglossus, palate. So it's attached to the palate and to the tongue. The palate would be the what? Origin, doesn't move. The tongue moves, so that would be the insertion. Styloglossus, appropriately named because that one is attached to the styloid process here, and then to the tongue. This is the origin, doesn't move that much. The tongue is the insertion. That's the part that moves. Stylohyoid, you can tell me where it's coming from the styloid process to the hyoid bone. Again, the hyoid bone moves up and down, the Adam's apple, right? So this is the insertion. This doesn't move. This just anchors the muscle. So that's the origin. Hyoglossus, again, from where to where? From the hyoid bone to your tongue, right? So again, the hyo part, the hyoid is your origin, and the glossus, the tongue part, is the insertion because that moves. Genioglossus, again, from the genu process, which are parts of your hyoid bone to the tongue. Um, Thyroid cartilage, this is the anatomical name for your Adam's apple. Your Adam's apple is actually this, thyroid cartilage, okay? All right, next up we have the pharyngeal muscles, and they come in 3 different groups: the superior constrictors, the middle constrictors, and the inferior constrictor muscles. What do they do? You would have guessed it as well, hopefully. They help you swallow. These are muscles of swallowing, as you can see here, okay? And what types of people have trouble with these? If you get a stroke, that affects the part of the brain where you have the swallowing center near the brain stem, right? If the swallowing center is affected, then you will lose the coordinated movement needed of these muscles to swallow food properly. So if you're working as a physical therapist or a speech therapist in a hospital setting, you often would be on call. You would be consulted for these stroke patients, especially in the neurosurgery and the neurology wards. Your job there will be to help these patients regain their lost skills, their speech, their movements, their sense of taste, smell, swallowing, right? So let's take quick notes here. Stroke Neurology ward, dysphagia, right? That's what it's called, dysphagia, inability to swallow, dysphagia, and PTOT. Okay, right. So muscles of the anterior neck, and they're divided into these groups: suprahyoid muscles and infrahyoid muscles. Why that? Because your reference point is the hyoid bone right here. All the muscles that arise from superior, from higher than that region, are called suprahyoid muscles. All the muscles that arise below the hyoid here are called infrahyoid muscles. Okay, names again give you a good idea of what they are. Genioglossus, from the hyoid bone to the tongue. Hyoglossus, from the hyoid bone to the tongue again. Um, and then thyrohyoid, from the thyroid cartilage, which is your Adam's apple, to the hyoid bone, like this. Sternothyroid, from the sternum or the breastbone to the thyroid cartilage, right? Sternocleidomastoid, we talked about that one before. Sternohyoid, from the sternum or the breastbone to the hyoid bone. So those names, literally, they're not lifesavers in terms of identification and what muscle you're talking about, what body region you're looking at, and what are the actions of those muscles, right? So these are generally, let's see. Okay. And so suprahyoid muscles in general, they elevate, they lift your hyoid bone up during swallowing or speaking. When your Adam's apple dances upwards, those are the actions of the suprahyoid muscles. The infrahyoid muscles pull the Adam's apple downwards. Infra means below. So there they are, right? Okay, so the anterolateral, the front and the sides of your neck, these muscles are generally used for flexing your neck, like bending it down. This is called flexion, right? Neck flexion. This is flexion of the neck. This is extension of the neck. This is a hyperextension of the neck, which would be a whiplash, basically. So sternocleidomastoid, the most powerful um, anterolateral neck muscle of flexion. Okay, it flexes, sternocleidomastoid, and also the scalene muscles, as you can see here. There you go. There's your sternocleidomastoid. You can feel it. So try pushing your, you see, you can see it here. This is my sternocleidomastoid. This cord of bundle of muscle that stands out. You can do it on yours. Try pushing your face against your palm, and your sternocleidomastoid muscle will kind of bunch up, right? You'd be able to see it. Okay, so look at these wonderful names again. This one is called levator scapulae. What can you tell me about this muscle? Levator, it elevates what? Scapulae, your shoulder blade. It elevates the shoulder blade, levator scapulae. Splenius capitis, cap, head, splenius, right? So this is a fine muscle attached to the head here. So again, the names tell you so much about the muscles. Here is your big trapezius muscle, also visible in a profile. Okay, so the muscles of the back of the neck, posterior neck muscles, which if they're here, what are they going to help you do? They're going to help you extend your neck, right? Or hyperextend like this. And what are their names? Trapezius, again, because trapezius in the back, the diamond shaped muscle in the back, that one. And then also splenius capitis, splenius cervicis. Again, capitis from the head, cap. Cervicis, cervix is your neck. So that tells you, right? Semispinalis capitis, again, from the spine to the head, semispinalis capitis. They're all posterior on the back. And longissimus capitis muscle, okay? There. So, and they're divided into the deep muscles of the posterior neck and the deeper muscles of the posterior neck. So I don't want you guys to exactly remember the names and the exact actions, but at least based on the names, you should be able to have a fair idea of what type, where that muscle is likely to be located at, and what types of actions it's able to accomplish, okay? Okay, so here is a clinical picture called congenital muscular torticollis. Commonly seen in children who have had like a difficult birth, more common in twin pregnancies because you have two kids in the uterus, right? And they're kind of like pressed against each other. Or if you have a baby with a very big head, such as what happens with diabetic moms, something called macrosomia, right? Macrosomy, large body, large head, and CPD for cephalopelvic disproportion. A large-headed baby, such as in diabetic moms, and the mother's pelvis is like kind of fine because humans do not have broad pelvises to begin with, that could cause problems, right? And so that uh, so the neck might be twisted at an unnatural angle and at an extreme angle, so the child is born with the head permanently elevated, turned to one side. That's what congenital muscular torticollis is, okay? So as it says here, head tilts to the affected side and chin to the unaffected side, okay? So what you can do here is physical therapy. Hopefully most of these conditions will resolve on their own, or you might need Botox because it paralyzes muscles, right? So it might loosen the muscles here. Okay, what muscles of facial expression must contract for you to smile? Zygomaticus major, zygomaticus minor, levator anguli oris, levator labia superioris, smiles, upwards. The corners of the mouth are pulled inferiorly into a frown by contraction of what muscle? Depressor anguli oris. There you go. The name is telling you. It's depressing, pulling down, depressing the angles of your mouth. Which extrinsic eye muscles abduct the eye, move the eye laterally? Lateral rectus, right? Lateral rectus does it. What movements do the medial and lateral pterygoid muscles perform? This, moving the jaw side to side. What is the general action of the extrinsic muscles of the tongue? They elevate the tongue. List the four suprahyoid muscles. Go back and check what they are. Common action. They lift the hyoid bone upwards. Suprahyoid up. Which neck muscles extend the neck? The ones in the back. Splenius capitis, splenius cervicis, longissimus capitis, all of those. Which neck muscles flex the neck? The big one is this one here, the sternocleidomastoid, right? Uh, that one, and the scalene muscles as well. Okay, so now we are looking at what are called your erector spinae muscles, because they erect your spine. Very important in humans. Again, bipedal walk. We walk on two legs, which controls our physiology, our anatomy, even our psychology. We talked about the sexy muscles. And there's this little article that some of you might have read on my ebook about foot fetish, right? The erotic attachment and sexual preference for the human feet. And it sounds like a weird kind of attachment and fixation to have, but if you read that article, it goes back to our evolution and how we are bipedal and how all of these structures help us make more attractive to our human mates and therefore make us even more human. All right, so let's take a look at these muscles of the vertebral column in the back, the erector spinae muscle, right? There they are. So let's start with the deep group, longissimus capitis, splenius capitis. Again, this is your posterior neck muscle. So this is the erector spinae. The iliocostalis, the longissimus, and the spinalis group. This one is the most lateral, most sideways, iliocostalis. Again, attached to the ilium, ilium of your hip bone. Costalis for your ribs. So from the ilium to the ribs. Look, the name told you where they're attached. Longissimus group is in the middle, intermediate, and this spinalis group is the most medial, right next to the spine, and therefore the name. All three of these help you stand upright, straight. Okay, and that should be your normal posture. You should not be slouched over and hunched over your devices. That's not good for your either your posture or your aging process, or it'll give you like things like arthritis and back ache and all kinds of problems. So you should make this constant attempt, constant effort, conscious effort to be upright. All right. If you're on your device, then take a break and walk upright, straight. And when you go for brisk walks, again, look straight ahead, anatomical position. Keep your back straight. Okay. That'll save you a whole lot of trouble in the future. Keep your weight in the acceptable range as well. If you're overweight or obese, try to shed a few pounds. So all this weight on your joints basically would be minimized, right? Okay, and these are the deeper muscles called the transversospinalis group, okay? There they are. So which muscles form the erector spinae? We just looked at them, iliocostalis, longissimus, and then this spinalis group. General actions, look at the name, erector spinae, erects your spine, straight walking. All right, so here we're done with part one of chapter 11. So we shall go ahead and start with chapter 2 here. All right, so here we are looking at the second part of chapter 11, and basically the muscles of respiration, right? or breathing, of course. And as we can see here, they have been divided into the muscles of inspiration, which means breathing in, and the muscles of expiration, which mean or exhalation, right? Inhalation, inspiration, taking breath in, and exhalation or expiration or breathing out. So what are those muscles? As you can see here, first step, diaphragm, your chief muscle of inspiration and expiration, breathing, period, would be this, diaphragm, okay? So it's a dome-shaped skeletal muscle that separates your thoracic cavity, your thorax or your chest, from your abdomen. So everything lying below the diaphragm is considered abdomen. Everything above the diaphragm here in the chest region is the uh, thoracic part, okay? All right, so what happens when you breathe in or when you inhale or you inspire? The diaphragm flattens. So instead of this dome shaped position, it moves down. It becomes flat, right? Here's a dome shape and then it becomes flat. So when it goes down and flattens, your chest cavity increases, right? More volume and it sucks the air in. And then, so what happens when you exhale or expire or you breathe out? It uh, again goes back to, all right, there's the bunny again in my backyard. So, all right, yes. So, sorry, I got distracted. Uh, I'm a big wildlife aficionado, if that's not obvious as of now. So, all right. So when it goes back to its original position, which is, so when it resumes its dome shape or moves up, that decreases your chest cavity, increases your intrathoracic pressure, the air moves out, right? So diaphragm is both, it's a chief respiratory muscle for both inspiration and expiration. Okay, let's move on to these external intercostals. Look at the name, intercostals, in between the ribs. That's literally what it means, and that's where the muscles are. External means they're located on the outside of the rib cage, right? So when they contract, they pull your rib cage outwards, so your rib cage expands, it gets larger. When does that happen? When does your rib cage get larger? When you inspire, inhale, or when you expire or exhale? When you inspire, again, exactly. So the external intercostals are your muscles of inspiration, breathing in. Then on the inner side of your ribs over here, you have the internal intercostals, as you can see, right? When they contract, they pull the rib cage back in. So your rib cage kind of collapses, right? When does that happen? When you breathe out. So internal intercostals are muscles of expiration. Scalene muscles, again, help you inspire, right? They help you breathe in. So the scalenes here are your accessory muscles of inspiration, right? What does that mean? Accessory muscles, when you need to breathe hard in on top of the muscles that you would normally use for normal breathing, such as when you've been underwater for a long time, someone is holding your head underwater, I hope not, or something like that. My uh, eldest, my son, he gets a thrill. He's 15, so the thrill-seeking age. So he gets a thrill out of doing that to his siblings, right? Just and I've told him multiple times this is not funny, right? So in any case, whenever that is uh, something to remember, let's see. And reference. Okay. Um, so then these accessory muscles of inspiration and expiration, they come into play, right? All right, so diaphragm, we talked about that before. Here it is. So now you're looking at an inferior view of the diaphragm from the top, right? You're looking down. So it's kind of like a clover leaf shape, as you can see here, right? Roughly, there is your the central tendon, this whitish region here. It's the tendon of the diaphragm. Tendon, remember, is the connective tissue that connects muscle to bone. And here you are looking at two openings. One is your caval opening, the other one is called the esophageal opening. And you would have guessed what they are there for. The esophageal opening is for the passage of the esophagus or your food tube from your oral and neck region down into your stomach. The caval opening is for your inferior vena cava, which is the main vein of the abdomen to pass up towards the heart. So one thing that I would mention here with with the esophageal opening is some people have a congenital, which means by birth condition called esophageal hernia or hiatal hernia, right? You might have heard of that, hiatal hernia. So what causes it and what is it? Well, in some people, the esophageal opening that you see here in the picture is like wider than normal. It's more common in preemies, in premature children, right? So the development is not completed to the point where this hole, this opening for the esophagus is larger in size than it should be. And if that is the case, then part of your stomach actually protrudes through this hole upwards into your chest. All right. And so that is what a hiatal hernia is, part of your stomach protruding through the esophageal opening into your chest. So what that causes is, of course, problems with breathing, right? Something called dyspnea. Uh, you have a child who has trouble breathing, flaring of the nostrils, maybe turning blue in the face, right? And on top of that is also like regurgitating food or vomiting, right? All of these could be signs and symptoms of a congenital hiatal hernia in a child. If you this condition goes undetected and you become a little older, then things like chronic heartburn, chronic dyspepsia, indigestion, and heartburn, because part of your stomach is literally lying in your chest, right? So you can use medical management like proton pump inhibitors and antacids to reduce the acidity of the stomach, but the only definitive treatment is surgical. You have to surgically to move the stomach back down into the abdomen, and you have to sew up the hole to close it, kind of a repair, a hiatal hernia repair, okay? Something to remember. All right, compare the actions of the external and the internal intercostals. External intercostals make the rib cage, pull them outwards, expand, so that's inhalation, and the internal intercostals collapse the rib cage, so that is for expiration or exhalation. How is the diaphragm involved in respiration? When it moves down, you breathe in, and when it moves back up to its dome-shaped position, that's when you breathe out. All right, so here are our almighty and much talked about six-pack muscles, as you can see, in the abdominal regions, the core muscles of the body, right? And again, as bipedal species, as upright walkers, we need that strong core because we are standing upright. We are not on all fours. Therefore, we need a strong core to keep our organs all well intact in there, okay? And also for your body movements. So athleticism, human athleticism is linked to a strong six-pack core abdominal region. All right, so what are those muscles though? Rectus abdominis, we talked about that one before. Now you can see why it's called that. Rectus means like straight sheet shaped, right? And in the abdominal region. Then you have this one here, transversus abdominis. You can see why it's called transversus. You see the fibers running transversely here, right? Then you have the external oblique muscle. You can see that why that's called that as well, because it has these oblique fibers running. When you strip off the external oblique, you get to the internal oblique muscles again, which are running obliquely here. So in together, these four muscles, they are your six-pack muscles. And an interesting thing is, they do not insert into any bone. They insert right here into what is called the linea alba, or the white line. So in these very well-developed muscles and bodybuilders and other people, you can literally see this line, which is the line of insertion of the abdominal muscles, of the six-pack muscles, right? It's quite clear here. All right. Okay, then you are also looking at the chest muscles like the pectoralis major, pectoralis minor here, right? All of them, right? The inguinal ligament, which in itself, it's formed by the tendon and the fascia of the external oblique muscle. It forms what is called the inguinal ligament. And this is important for a condition known as inguinal hernia, which is way more common in men than in women. So we'll talk about that too, why that happens. So there you are. You can look at your six-pack muscles in this cadaver. I don't know if it's a human, looks like a human cadaver, yes. But if you dissect like minks or rodents, they look, or cats even, they look very similar. So there you can see the rectus abdominis, the straight muscle. Here's the transversus abdominis muscle, right? External oblique, and then the internal oblique muscles. You can see all of them. So what do these six-pack muscles do altogether? They help you laterally flex the vertebral column. So when you do this side-to-side movement at your waist, that is lateral flexion of the vertebral column, right? And rotate it to the opposite side. This, moving side to side and doing these punching motions on two sides, right? That strengthens your core. So here we are, inguinal hernia. So what happens in inguinal hernia is, okay, here. So the inguinal hernia is, well, the inguinal ligament forms something called the inguinal canal, okay? It's a passageway, a narrow passageway from the abdomen into the pelvic region. In males, the inguinal canal is way wider and bigger than in females. Why? Because, so let's take some notes here. Reasons for inguinal hernia. All right, because in males, the inguinal canal contains a spermatic cord, And the spermatic cord itself contains the this tube called the vas deferens that carries sperm and semen from the testicles to the urethra, right? And also the tympaniform plexus, which is a network of veins that's drain the testicles, and the testicular artery, and some lymph nodes. So all of those structures are found within the male inguinal canal. It makes it wider. In females, no such structure. In females, all you have is the round ligament of the uterus that passes through there, which is quite small. So what does that translate into? So if you have a big, wide inguinal canal, as in males, anything that raises your intra-abdominal pressure here, like chronic coughing because of COPD or some other infection, or even constipation, or straining while urinating because you have BPH, benign prostatic hyperplasia, right? All those kinds of things. They can literally cause your intestines to pop out of their covering, the peritoneum, and get impacted into this inguinal ligament. All right, the inguinal canal, which is very narrow. So here you have a part of your intestine, your gut, which is stuck in your inguinal canal. Once that happens, then you're at risk for this. Every time you cough or lift any weight or your intra-abdominal pressure rises, it's going to push your gut deeper down the inguinal canal. The worst case that I've seen in my practice was of an 80-year-old person, 80-year-old inguinal hernia patient, right? And basketball sized scrotum. So this was an 80-year-old male who obviously has had this inguinal hernia for quite a long time, never sought any treatment. And so at 80 years of age, he presented to the hospital, at which point his scrotum, which is the sac of skin that contains the testicles, was the size of a basketball-sized scrotum, because a large portion of his colon, his large intestine, had actually ended up in the scrotum through the inguinal canal. So, and it can get even worse than that. So that is what an inguinal hernia is. In some of the more complicated cases, you might have an incarcerated or a strangulated hernia, right? Or a perforated, a ruptured hernia. So what happens there? So let's take some notes. Incarcerated or strangulated hernia. So what happens there is, so imagine your intestine, part of your colon, like caught in this tight space in the inguinal canal, right? So it puts a lot of pressure on the neck of your intestine. So the blood supply gets cut out. It's just like if you tie a wristband which is too tight, what's going to happen to your hand? You're going to lose all blood supply there. Now this happens to your gut, your intestine. That's called strangulation. Worst case scenario, it's going to die off, it's going to rupture, and then all of that gunk, the fecal matter, is going to spill out of your intestines and infect your peritoneum. Now you have developed peritonitis, a full-blown case of peritonitis. And I've talked about what that does to you. That is an acute emergency. You have to do surgery to save this patient's life right away, okay? So that's what the inguinal hernia is all about. It is fixed surgically in a process called herniorrhaphy or hernioplasty. You basically, what you do is you cut into the inguinal region, you push the colon gently out of the inguinal canal, and then you put like a mesh, like a net on there to prevent the intestine from getting back in again. All right. So what are the main actions of the abdominal muscles? Your six-pack muscles, lateral flexion, and then moving your torso side to side. We talked about that too. So here you're looking at the muscles of the pelvic floor. All right. What is called the pelvic diaphragm. So if you look at the names here, iliococcygeus from the ilium, iliac region of the bone, to the coccyx, to the tailbone, and pubococcygeus from the pubic bone to the coccyx, to the tailbone, right? And together they're called the levator ani muscles because they elevate the anal region, as you can see here. Um, and so this pelvic region is where you have all of your reproductive and your urinary tract organs, right? And that's pretty much what you see here in this picture as well. So this is called the urogenital diaphragm, as you can see, all of the pelvic muscles in this region. All right, so next on to the perineum. So perineum is this diamond-shaped region that extends from the base of the genitals, both in males and females, all the way down to the anus. And then the perineum is divided into these two regions, a green upright triangle, as you can see here, and a blue inverted triangle. The green upright triangle is called the urogenital triangle, and the one that is facing down this way, that's called the anal triangle, all right? So what do you have in the urogenital triangle first? Primarily these two muscles, bulbospongiosis and ischiocavernosus in both males and in females. So you see they're very similar, same muscles are found there in the pelvic region, okay? And then they're supported by these superficial transverse perineal muscles as well. So what is the function of these two muscles, right? So bulbospongiosis and ischiocavernosus. So think of it this way, the bulbospongiosus muscle enables ejaculation in males and the expulsion of the final few drops of urine. That's what this bulbospongiosus muscle does, all right? Ejaculation in males and uh, expulsion of urine, okay? So that's your bulbospongiosis. The ischiocavernosus muscle is your muscle of erection, both in males and females, clitoral erection in females and penile erection in males. So basically that's what it does, all right? So then you have these exercises called Kegel's exercises that I'm sure you have heard of, right? Kegel's exercises. And they are meant to strengthen the very same muscles that we have just mentioned, the muscles of your urogenital diaphragm, the pelvic muscles. And the exercise like could be as simple as a squatting up and down, right? Or lifting weights while doing squats. Or some people would advise like when you're urinating, try holding your urine midstream for a couple of seconds and then let go again and then try holding it again. I'm not personally too fond of that version because especially if you're prone to urinary tract infections and UTIs, it's kind of painful and it can lead to like some infection or urinary retention and stuff, right? But lifting weights, doing squats, they're good. And so you want healthier, stronger pelvic muscles because they become important during childbirth in females, especially if you've had a difficult labor, the child with a large head and the pelvic opening is small, right? And so then in those cases, the OBGYN would have to perform an episiotomy, which is a surgical incision, right? Episiotomy, a surgical incision meant to dilate that region, the birth canal, so that birth can take place easily. And after that, to regain your pelvic tone, Kegel exercises are quite helpful there, all right? They also prevent things like uterine and vaginal prolapse, right? Uterine prolapse, uterine/vaginal prolapse, even hemorrhoids could be avoided or minimized because of Kegel exercises as well. So what happens in uterine/vaginal prolapse is especially more common in overweight or obese women who have had multiple births. The uterus kind of has undergone the birthing process so many times that it kind of bulges all the way down. There's like a first degree prolapse, second degree prolapse, and third degree prolapse. In third degree prolapse, the uterus, almost entire body of the uterus is hanging outside of the vagina. All right. and that's prone to infections and all kinds of complications. And surgery is the way to fix that at that point. Um, Hemorrhoids, same thing. Hemorrhoids is bleeding veins, venous columns in your anal region, and they also come in first degree, second degree, and third degree hemorrhoids. And third degree hemorrhoids, the entire anal column literally hangs outside of the anus. Uh, Prone to infections, friction, lots of pain, all those kinds of things. So we just talked about the functions of the pelvic floor muscles. They hold your urinary, genitourinary organs intact. Okay, anterior thoracic muscles, muscles of the chest, right? The main one here is the pectoralis major muscle, this big convergent, it's converging here, all the fibers. And so what the pectoralis major muscle, the pecs, if you will help you do, laterally and medially flex the arm, also abduct the shoulder, right? Push the shoulder outwards. All of those are actions of the pectoralis major. Just underneath the pectoralis major is the pectoralis minor muscle, as you can see here, right? You also have the rotator cuff muscles here, subscapularis and subclavius below the clavicle. These muscles help you rotate your scapula, circumduct your arm in a circular motion. We already talked about sternocleidomastoid. All right, these muscles are called the serratus anterior muscle, which literally means serratus, like they have serrations, jagged teeth, like a saw-toothed or jagged-toothed, right? Because if you look here in this picture, it's not too visible, but the fibers look like those are teeth, right? So serratus anterior muscle here. That one also stabilizes your scapula. Deltoid, that's your shoulder muscle for abduction of the shoulder, moving it outwards like that, right? Okay, so muscles that move your pectoral girdle and the shoulder joint muscles. These are your rotator cuff muscles, the supraspinatus, infraspinatus, subscapularis, right? Rhomboid minor, rhomboid major. They help rotate your scapula so you can move your shoulder joint. Remember, the shoulder joint is very mobile, but not that stable. And so that's quite apparent here, if you see, okay? All right, trapezius, look at the trapezoid shape. Like a trapezium, right? It's like a diamond shape in the back. Levator scapulae, tell me what that muscle does. Look at the name, levator. It elevates your scapula upwards, elevates your scapula or your shoulder blade upwards. Latissimus dorsi, it's a dorsal muscle, dorsal in the back, and latissimus, like broad sheet shaped like this. And this helps you like do the punching motion, right? When you make the punching motion, your latissimus dorsi basically contracts at that point. Okay, so we are looking at the retractors and the protractors of the scapula, right? Retracted scapula when you're standing upright, good posture, as you can see. Protracted scapula when you're like kind of hunched forward like this, right? So what are the protractors of your shoulder joint? Like punching forwards, pectoralis minor and serratus anterior primarily. What are the retractors on this side? Arm going backwards, trapezius in the back, and rhomboids. And these are the rotator cuff muscles again, right? The muscles that elevate or lift your scapula upwards here, the two rhomboids, the levator scapulae, and the trapezius, the superior part. Depressors, these ones move your scapula downwards. That would be the inferior part of the trapezius and the pectoralis minor. Superior rotators, rotated upwards, serratus anterior and trapezius. Inferior rotators, rhomboids, and the levator scapulae muscle as well, okay? So here are your rotator cuff muscles, okay? And this is a good picture to basically explain what each of those muscles do, what kind of motions. So the subscapularis here, right? It kind of helps in winding up for the pitch. Just as you release the ball, it's your supraspinatus. And after you follow through with the action here, that would be your infraspinatus muscle, okay? And so the question might be, so yeah, these are important notes for your latissimus dorsi as an example, right? It's your arm extensor, also adducts and medially rotates the arm. The pectoralis major, it flexes your arm, basically, right? And also adducts and medially rotates the arm. All right. So which of these three actions is most prone to injury, okay? It's actually the one in the middle, right when you are releasing the ball right up here. So your supraspinatus is most prone to injury. So when you talk about rotator cuff injuries, It's mostly your supraspinatus, which is involved there, right? And what would cause pains, swelling, tenderness, inflammation here in the shoulder region. Treatment, rest, ice, right? Sometimes you need a sling just to stabilize the joint, right? Painkillers, and in severe cases when the rotator cuff injuries, like a strain where the muscle is actually torn away, that may require even surgical repair, all right? Okay, so here we are looking at the arm, right? The upper and the lower arm, as you can see. And so that region is divided into an anterior, front, or the flexor compartment, this one, and a posterior, or the extensor compartment in the back, okay? So here, this is your extensor compartment, the triceps in the back, and here is your flexor compartment, right? So flexor here, that would be your biceps brachii, your brachialis muscle, as you can see here, as well, right? Brachialis, coracobrachialis. So these three, biceps brachii, brachialis, and coracobrachialis for flexion, as you can see here in the flexor compartment. Okay, as far as extension is concerned, moving the arm the other way like that, the prime agonist or extensor here, of course, is your triceps brachii, but also the enconius, this muscle here, that also helps. It's a synergist. It helps the triceps extend the arm as well, as you can see. Okay, so then let's take a look at the muscles of the forearm, right? And these have to do with pronation and supination. Again, remember, supine is palm up. Prone or pronation is palm down. Palm up is supine, palm down is prone. So what are those muscles? The pronator quadratus, again, the name tells you it pronates. It helps you pronate your arm here, or pronator teres, same thing, pronation. And then a muscle that is literally called supinator. So it helps you supinate or move your palm, make it face upwards, all right? So what is tennis elbow? So called because it's more common in people who play tennis and then who like serve the ball this way, right? It's basically, technically, it's lateral epicondylitis. It's an inflammation of the lateral epicondyle of your humerus and then the radius, the humeroradial joint here, okay? Because of repeated forceful contractions of the forearm extensors, okay? Treatment, same. Rest, ice, sometimes a sling is needed, compression, just to hold the joint together, and painkillers, all right? It's conservative treatment. All right, so here we are looking at the muscles of the flexor compartment of the arm. It flexes the wrist. These are flexors, right? And a good way of remembering what those flexors of the forearm is to look at this picture. See how you're using your right hand and then the left hand fingers placed flat on there. So your index finger here would be your pronator teres muscle, which pronates your forearm again. The second one would be the flexor carpi radialis. Again, what does the name tell you? It flexes, carpus is your wrist, radialis is your radial side. So it moves your wrist sideways, flexor carpi radialis, right? And to contrast that with your pinky, which corresponds to the flexor carpi ulnaris muscle, that moves your wrist medially. So this is flexor carpi ulnaris. This is like when you hitchhike this way, that's flexor carpi radialis. And when you go in the opposite direction this way, that's the flexor carpi ulnaris, right? Okay, so at this point, let's also talk about the carpal tunnel syndrome, okay? Who gets it? Again, people who are overweight, inactive, don't get much exercise, smokers, people who are overweight or obese, people who work on computers and on typing devices for long periods of time, or play the piano or any motion where they have to like move their wrist, okay? So what happens here is your median nerve, which supplies the muscles of and the skin of your hand, it runs in a very narrow space through your wrist. It runs through what is called the carpal tunnel because it's surrounded by the tendons of these flexor muscles on all sides, right? So when you're repeatedly like moving your wrist like this, sometimes it causes these tendons of your muscles to swell up. right? They swell up, they inflame. So when they swell up, here's the median nerve running in between. When they swell up, they pinch the median nerve in between, and that causes pain and pins and needle sensation and weakness of the hand. And that's what carpal tunnel syndrome is. So the treatment, lose some weight, quit smoking, get some exercise. You might need to wear like wrist splints or those kinds of things so that you're not moving your wrist, rather you're using your fingers for whatever you're doing, right? So rest, ice, compression, all of those things. Um, in rare circumstances, if the pain is really unbearable and it's uh, interfering with your activities of daily living, then you might have to surgically widen the carpal tunnel, right, to move the tendons apart, so you don't have that feeling here. All right, so then here we are looking at uh, the flexor compartment of your right forearm, right? So in the superficial view of your right anterior forearm, as you can see here, all right, those are the muscles that, again, we saw with someone placing their left palm, all of those muscles, the pronator teres, lateral most, right? Then the flexor carpi radialis, then the palmaris longus, and then the flexor carpi ulnaris. You see all of those flexor muscles here in this picture. All right. So intermediate and deep views of again, the same right anterior forearm, as you can see, flexor digitorum superficialis, right? Look at the name, it flexes your digits there, flexor digitorum superficialis, right? And then the tendons of the same muscle going all the way down attached to your fingers, okay? And then a deeper version of that muscle would be the flexor digitorum profundus, profundus, deep. So flexor digitorum profundus does the same thing, causes you to flex your fingers, as you can see here. All right. Okay, now we are looking at the extensor compartment. This was the flexor muscles that we were looking at. Now we're looking at the back, which is the extensor compartments, okay? So let's see what those muscles are in a superficial view. So you have the brachioradialis. This one is a flexor of the forearm. These are the extensors. Extensor carpi radialis longus. What does it tell you? It extends your wrist, extends in the radial region, right here. Then extensor carpi radialis brevis. There's a longus muscle with a longer body, and then there's a brevis, smaller muscle, right? But the action is the same. And then the extensor digitorum muscle, which extends your fingers again. Then you have the abductor pollicis longus. It abducts your pollex, which is your thumb, abducts your thumb, this abduction, right? Moving it away from the midline. And then the extensor pollicis brevis. This one extends your thumb, like when hitchhiking again, this thumb extension caused by the extensor pollicis brevis. So again, the names tell you pretty much where they are found and what their action is. So on this side, you have the extensor carpi ulnaris. It extends your pinky, right? Your ulnar region over here. Extensor digiti minimi, again, digiti minimi is your smallest finger, the pinky, right? Then the extensor retiniculum is this like tendon, this kind of like a ring through which all of the tendons of the extensor muscles pass. And these are the tendons of your extensor digitorum muscle, again, for extending the fingers. Okay, same muscles here, extensor pollicis longus, there, this motion. Extensor indicis, it extends your index finger. Extensor indicis, right? All right, extensor pollicis brevis, again, it extends or raises your thumb upwards. Abductor pollicis longus moves the thumb, abducts it, moves it away from the palm, and then the supinator muscle at the top. All right, let's take a look at the muscles of the hand, all right, in a superficial view. So what are they? Let's see. So first, this ring of connective tissue called the flexor retiniculum, through which the flexor muscles pass onto the hand. Just focus on the names, all right? So first up, this area, which lies at the base of your thumbs, is called the thenar region. And this area, which lies at the base of your pinky, is called the hypothenar region. So here, these are the thenar muscles These are the hypothenar muscles. All right. So what are the thenar muscles at the base of the what? Of the thumb? Uh, adductor pollicis, flexor pollicis brevis, abductor pollicis brevis. So all of these pollices containing, because from the pollex, which is your thumb, they are part of the thenar muscles here, right? This one is the flexor pollicis longus. It flexes your thumb. This is thumb flexion, moving it down, right? Okay, now let's take a look at the hypothenar here, hypothenar muscles, right? Flexor digitorum profundus, well, these ones, flexor digiti minimi, it flexes your little finger, digiti minimi brevis, abductor digiti minimi, causes your pinky to move away, abductor pollicis minimi, digiti minimi, these two here. And then the lumbricals, which literally means these worm-like muscles in between the lumbricals that help with the extension and flexion of the digits as well. All right. So some other muscles in a deeper view of the hand, look at the names. Opponent's pollicis, it causes your thumb to be opposable like this, right? We have opposable thumbs. All primates have opposable thumbs. And then we talked about these ones, flexor carpi radialis muscle, its tendon, abductor pollicis longus, one of the thumb abductors that you can see here, right? Here's the carpal tunnel. The median nerve passes through here, right? So let's take notes. Carpal tunnel and median nerve. All right. And in the back of the hand, you have the extensors. Extensor pollicis longus extends the thumb, extensor pollicis brevis, extensor digiti minimi extends your pinky again, abductor digiti minimi moves it sideways, extensor digitorum, so you see those muscles here as well. Okay, list the posterior thoracic muscles that move the pectoral girdle and describe their common actions. The posterior thoracic muscles, so those would be your scalenes, those would be your rhomboid major, rhomboid minor, teres major, teres minor, right? And the common action, they elevate the scapula. They elevate the scapula. Which muscles extend the arm at the shoulder joint? So latissimus dorsi, right? It's an arm extensor, as well as your triceps. Identify the rotator cuff muscles, subscapularis, supraspinatus, infraspinatus, teres minor. Describe their actions. We looked at the picture, right? What are the muscles in the anterior compartment of the forearm? The flexor digitorum superficialis, the flexor digitorum profundus, pronator teres, palmaris longus. What common actions do they perform? They cause flexion of the wrist, this. What muscles pronate the forearm? The pronator muscle, pronator teres and the pronator quadratus. And which supinates the forearm? It's simply called the supinator muscle. What are the common actions of muscles in the anterior compartment of the forearm? Flexion, wrist flexion and arm flexion. What muscles in the posterior compartment move the thumb? The extensor pollicis longus, extensor pollicis brevis, right? Abductor pollicis, all of those. Which group of intrinsic hand muscles is primarily responsible for moving the thumb? The thenar muscles, right here, thenar muscles. Okay, so now we are down to the thigh region, okay? And so we are looking at your quadriceps, the front of the thigh, right? The quadriceps muscles are made up of these, the adductor longus muscle, the adductor magnus, right? And the adductor brevis. They all adduct the thigh, bring it closer to the midline, moving your leg closer to the midline, right? Okay, how about the posterior thigh, the back of the thigh, the gluteus maximus, gluteus medius, gluteus minimus, all of those here, all right? And so their job is to like help you rise from a squatting position, okay? All right, so here are your quadriceps femoris muscles. Rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So the three vastus muscles and the rectus femoris. And the main job of your quadriceps muscles is to extend the knee. So when you as in kicking a soccer ball when you kick it. So you extend the knee, okay? You can even feel it when you move your leg forwards. Just feel your quads, your quadriceps muscles, they become tight. Uh, and so because it pulls on the quadriceps tendon, as you can see here. All right, so here are your quadriceps muscles, the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis, okay? And their common action is knee extension. All right, so let's move on to the back of the thigh, and those are called the hamstrings. And the hamstrings, again, are made up of these four muscles, or three muscles rather: semimembranosus, semitendinosus, biceps femoris, long head, and short head. All right, and what is the, and you can see those muscles clearly in this picture as well. What is their common action? Knee flexion, such as when you bend your knee flexion, okay? Flexes the leg, flexes the knee, as you can see here. All right, down to the muscles of the ankles, foot, and the toes, as you can see here. And here they are, right? So again, the names pretty much tell you what they are. Extensor hallucis longus, it extends the hallux. Hallux is your big toe. Extensor retiniculum, this ring of connective tissue there. Then extensor hallucis longus tendon, again, moving your toe upwards, extending it. Extensor digitorum longus, extending your toes, moving your toes upwards, right? Extensor hallucis brevis as well. On the lateral side, you have the fibularis tertius tendon, the fibularis muscle on the side of the fibula, which is lateral here, right? So in fact, on the lateral side, you have these two muscles. You have the fibularis longus and the fibularis brevis. Both of them help you evert the foot, move the foot outwards, evert it, all right? And then you have these powerful calf muscles called the gastrocnemius, two heads, a medial head and a lateral head of the gastrocnemius. And what that does is it helps you plantar flex your foot, move your foot down like this, all right? So the calf muscles in the back. So here you're looking at the side view, the lateral view of the leg, the lateral muscles. So again, they are on the fibularis longus, fibularis brevis, fibularis tertius, all of them fibula, that terminate their name. So they help you with everting the foot, moving it outwards like this, okay? There they are. Now you can see the lateral leg muscles. Okay, so calf muscles, the major ones are gastrocnemius, medial head and a lateral head. And the gastrocnemius inserts itself by means of the calcaneal tendon into the heel. All right, this is your Achilles heel, literally, because if you cut this tendon, the person can't stand, right? So Achilles heel is based on Greek mythology. The guy whose only weakness was his ankle, right, the back of the ankle. So Achilles heel connection. So that's the tendon of your gastrocnemius muscle, which is seen here, right? And then you have some of the other weaker muscles like the soleus muscle. All of them plantar flex the foot, move the foot down. Plantar flexion, okay? Okay, shin splints, pain in your shin bone, common in like runners and walkers, brisk walkers, right? So you feel the soreness along the length of the tibia, as you can see. Compartment syndrome is when the muscles and the tendons in your arms or in your legs swell up because of repetitive use, and thereby they cause a lot of like pain and inflammation. The nerves that are running in between them, supplying the muscles, they get pinched. It's kind of like a carpal tunnel syndrome is a type of compartment syndrome. So you have to take rest, make sure, wait for the inflammation of the muscles to subside. In severe cases, as it says, surgically, you have to cut the fascia. You have to literally release the muscle from this pressure, okay? All right, so these are the plantar intrinsic muscles of the foot on the soles of the feet. Here they are. The flexor digitorum brevis, it flexes your toes, toe flexion, moving them down. Abductor hallux or hallucis moves the big toe away from the other toes, right? Adductor hallucis muscle, this one moves the toe back towards the toes. The flexor hallucis brevis, right? The same muscles. Abductor digiti minimi, causes your little finger, little toe to move away. And then the abductor hallucis. Again, the same, we talked about that one before as well. Plantar fasciitis. This is a clinical condition most commonly seen in people who are overweight or obese, right? It's like this deep, boring pain in your heels, especially if you keep standing on your feet for long periods of time. Factory workers, soldiers, people who are required to be upright for long periods of time. Also, if you're like a lopsided, so you tend to like favor one leg over the other and like shift your weight over there, you're more likely to get plantar fasciitis. Treatment, again, take a break, take rest, elevate your feet, wait for the swelling to go down, lose weight, be physically active, don't smoke. If needed, painkillers, Tylenol, ibuprofen, those kinds of things, right? And if it's a sometimes poor shoe size or shoe shape can do it too. So look at things like that. List the compartments of the thigh: anterior, lateral, medial, and posterior. Okay. So what are the common actions? The muscles of your front of the thigh extend the knee joint. Muscles of the posterior thigh flex the knee joint. Muscles of your lateral thigh or lateral lower leg evert the foot. Muscles of the medial group invert the foot, right? List the thigh muscles that flex the knee joint. So those would be your hamstrings. Hamstrings are three: semi-membranosus, semi-tendinosus, and biceps femoris. Okay. All right, the intrinsic muscles of the foot that extend the toes: extensor digitorum, extensor hallucis longus, extensor hallucis brevis. Simple. The big toe is called hallux. So all of those muscles. All right, so here we are done with chapter 11. I'm going to share this with you shortly along with the notes. Lecture exam is tomorrow. You have the study guide, so good luck there. And then tomorrow I also have chapter 12 to share with you. So I will do that. In the meantime, make sure you keep up with all the studies. Any questions, suggestions, feedback, please let me know. Have a wonderful rest of the evening. Stay safe and healthy and happy. And I'll see you all tomorrow virtually, same time, roughly. Bye-bye.